Hello, welcome to my video on informed consent. I will briefly go over the Mississippi state laws for practicing as a licensed professional counselor and how it compares to the ACA Code of Ethics. I also will be comparing a consent form written by Regina Verlaguleri, who practices out of Mississippi. I wanted to point out the importance of comprehension when obtaining informed consent from our clients. Petrozowski and Smilowska conducted a study in 2021 on patients' comprehension on informed consent. The study revealed that patients did not fully understand the risks and benefits of interventions used and also the free will to express their needs in the therapy process. This is very alarming as counselors are obligated to practice in an ethical manner to reduce risk in harming their clients. Chapter 7 in the Mississippi Rules and Regulations describes the professional responsibilities of LPCs. Rule 7.1 addresses that LPCs who are licensed through the state board must adhere to the American Counseling Association's Code of Ethics. In doing so, LPCs are operating in the best interest, protection, and safety of the public. We will compare the ACA Code of Ethics to a consent form written by Regina Verlaguleri. Section A of the ACA Code of Ethics, Part A2A, addresses the client's ability to freely choose to stay or leave the counseling process, and also the counselor's role in communicating the rights of the counselor and the client. Regina addresses the importance of clients choosing to terminate or stay in her form, and also express that if the client was confused, to reach out with any questions. Part A2B addresses the type of information needed, such as goals, techniques, procedures, limitations, risks and benefits, counselor qualification and credentials, services after death of the counselor, technology uses, intended use of reports and tests, informing on fees and billing, and confidentiality in obtaining client records. Regina stated the possible risks of therapy, such as feeling sadness, guilt, anger, loneliness, helplessness, and also the benefits, including reduced distress, problem-solving skills, coping skills, and better relationships. She explained the techniques she uses, such as CBT and solution-focused therapy. She explained what her goals are for therapy outcomes, like fostering growth through awareness and acceptance. Regina stated her credentials as an LPC and holds her master's degree. I noticed she did not mention how much experience she had in the field. In the confidentiality section, she did state the limitations and exceptions, such as abuse, suicide, risk, court order, malpractice lawsuits, and insurances requesting diagnoses. She went over fees and payments with and without insurance, cancellation policies, missed appointments, legal fees, and offering phone consultation and online services. Section A2C says counselors must communicate in a way that is culturally sensitive to the client. Counselors must take initiative in making sure clients fully understand all parts of informed consent, even if that means getting an interpreter. She used language in the form that was easy to understand and read. A2D addresses the inability to give consent. This may involve getting parents or a guardian to make informed decisions for the clients. Regina explained that if a minor is seeking counseling and the parent wants to know what the child is saying, then the counselor would have to sit down with the whole family and express the child's needs that way. A2E addresses mandating clients. This section explained that counselors must explain the limitations to clients who are forced to enter counseling. This means explaining to the client what information will be shared with, such as higher authorities, and explain the consequences that if they don't participate in counseling. Regina followed the ACA Code of Ethics. If I were to add to this form, I would emphasize the ongoing role of informed consent throughout the therapy process. Thank you for listening.